the old interview with Fauci as false information. But he sure seemed convincing. But that's not all. An April study published in Nature seemed consistent with the old Fauci as well. It measured and compared viral shedding in the coughing of 111 participants, some wearing masks, some not. The results? Among the samples collected without a face mask, we found that the majority of participants with influenza virus and coronavirus infection did not shed detectable virus in respiratory droplets or aerosols. For those who did shed virus in respiratory droplets and aerosols, viral load in both tended to be low. Wait, what? The majority of confirmed coronavirus infections without a face mask didn't shed detectable virus in respiratory droplets or aerosols? And for those who actually did, the minority, there was very little virus present? Okay, wait, it gets better. The major limitation of our study was the large proportion of participants with undetectable viral shedding and exhaled breath for each of the viruses studied. We could have increased the sampling duration beyond 30 minutes to increase the viral shedding being captured, but apparently people didn't want to do that. So again, let me just explain this. Over the space of 30 minutes, they were unable to capture any viral shedding in a large proportion of participants with confirmed known infections. Again, what? Indeed, they go on to explain that perhaps forced coughing might have helped. Forced coughing? So the issue, as is explained in this study, is that non-coughing or sneezing people are by and large not shedding virus in their ordinary breath. If they're coughing, well, of course, that's a different story, of course. Someone who is actively sick is, well, they're actively sick. But especially now, many coronavirus infections are not symptomatic for cough. And among those actively sick but not coughing, they had great difficulty in this study finding virus expelled under lab conditions. And lab conditions has extremely sensitive equipment. Again, these are people who were actively sick and had a fever. So much for the theory of asymptomatic shedding of infectious virus out of one's mouth or nose. By the way, the entire premise on which the mask mandates are predicated.